Behold the Jewish penicillin. In the 12th century, the historic rabbi and physician Maimonides claimed that chicken soup had medicinal properties. Who knows? What we know for sure is that bringing chicken soup to someone who is ill is a beautiful act of caring that's been performed for centuries. You don't feel so good? I don't want to sit idly by. Let me help. Let me do. The romantic themes that shaped New York's immigrant history, starting fresh, pursuing your dreams, these were beautiful notions. But the living, 24 hours at a time, was very hard, especially for the elderly. And so it was that during the harsh economic climate of New York in the early 1900s, 4 incredibly compassionate Brooklyn ladies, Sarah Berlin, Flora Groden, Sarah Webelovsky, and Emma Rosenthal, founded the Brooklyn Ladies Hebrew Home for the Aged. The home provided poor, elderly members of their community with quality health care and a safe place to live in their time of greatest need. Today, that spirit of caring and willingness to act lives on as MJHS. Rooted in the values of compassion, dignity, and respect, what began as a single home for the aged in Brooklyn in 1907 now provides a spectrum of innovative health services for adults and children of all religious, cultural, and economic backgrounds. In a very real sense, we recreate our founding moment every day. We look into the eyes of people who need us, and we do something.
So I know that without this place here, I would be a lost soul.
This is Ricardo Max Maxwell. What he has is MS. What he is one of a kind. We encourage him. He inspires us. In 2014, understanding the growing importance of palliative care and the need for thought leadership, research, and education, the MJHS Institute for Innovation in Palliative Care was launched. In addition to breaking new ground, the work of the Institute helps advance our continued commitment to providing life-changing palliative care for our patients living at home.
I just don't want to let the pain overcome me. I want to overcome the pain.
May Brandt was living with chronic, debilitating pain that could not be managed until she met MJHS palliative care specialist Mary Drayton.
Mary Drayton spent the most extraordinary amount of time with my mother to try and really understand where the pain was coming from, the intensity of the pain.
So Richard and I went through all her medications. Went really in depth into a pain assessment, talking about the onset, the intensity of it, things that made it better, things that made it worse.
I have watched my mother go from being virtually incapacitated to being able to freely walk from room to room. It literally was like being in shackles and having the shackles lifted off.
Continuing the commitment of the Brooklyn Ladies to serving the healthcare needs of the elderly, Elder Plan, including Home First, offers a range of Medicare, Medicaid, dual, and long-term care plans for seniors and adults with disabilities. An innovator, Elder Plan was one of the first social HMOs, and Home First, one of the original MLTCPs. Today, the good people at Elder Plan continue to offer innovative plans, like FIDA, to care for at-risk members of our community. Sharon Hutton is the mother of Jonathan, a quiet boy who loved to watch trains, spend time with his siblings, and draw pictures. He had an inoperable brain tumor.
The social worker met with me and said that she would have a nurse, if I wanted a nurse to come and see Jonathan in the home, and I said yes.
At MJHS, we try to keep patients at home, and especially with a child, it's very important to have them at home, surrounded by their loved one and familiar surroundings. Pediatric hospice is unique, and it's something that's being developed, and MJHS was one of the first hospices to offer that service.
Having the hospice team here in Jonathan's last moment was of great comfort to me. The aide was here and she was right by me, and at the very moment I needed him, the nurse came in and I didn't have to do anything. I just sat there and held Jonathan.
Continuing a tradition of innovation and compassion, today MJHS is one of the few hospice programs able to care for children who are still actively seeking curative treatment. And the MJHS Hospice Inpatient Residence is the first residential IPU in New York City that cares for children as well as adults.
I love you too, buddy.
This is the Menorah Center for Rehabilitation and Nursing Care, located on 10 beautiful oceanfront acres in Brooklyn's Manhattan Beach. It's been called the gold standard of modern nursing care, not just for its outstanding subacute rehabilitation services, but also for its innovative long-term care programs, like music therapy for dementia patients, that significantly improve quality of life for our residents and also staff satisfaction.
Some of the goals for the program include addressing the reduction of agitation and depression and anxiety in residents with mid-stage dementia.
Love is never gone. Since the music, Marilyn has really opened up, and she would talk about her 3 boys, her husband that passed away. She would tell me the good and the bad. She had sad times and she had happy times.
The knowledge and understanding of all New York's diverse populations is a hallmark of MJHS. Angela Shi cared for the family of Tiffany Chow. Angela doesn't just speak her language, she brings her the comfort of sharing a culture.
MJHS give us a good service to my parents. Without their help, and I cannot imagine, because I'm not all the time at home. So it's very important for us to have this kind of care.
When I first time come to this house, I feel like this is like my home. I try to my best help our Chinese patients.
25 years ago, Joanne Harris had a stroke. She thought her life was over. Then she met therapist Alice Cohen.
All I was presented with, both internally and around me, were expressions of limitations. And when I came here, I was exposed to a world of possibilities.
I'm really impressed with Joanne. I met her about 11 years ago, and she's been consistently positive.
So I tell Alice she should prepare for the time when we start 25K training. So she said, from your lips to God's ears, and that's absolutely right.
From a single building among the tenements, MJHS has become one of the most innovative health systems in the region. We were one of the first hospice and palliative care programs serving patients in the comfort of their homes. We are one of just a few hospice programs to care for children who are still actively seeking curative treatment. Our residential IPU is the first in New York City to care for children as well as adults. And the MJHS Institute for Innovation in Palliative Care leads the way in thought leadership and education. We are the first home care organization in the country to receive Joint Commission certification for our heart failure disease management program. Menorah was ranked as one of the best nursing homes in the country by U.S. News and World Report. And Elder Plan, including Home First, remains at the forefront of providing Medicare, Medicaid, dual, and long-term care plans.
For more than 100 years, we've been there whenever and wherever we could make a difference. The culture of philanthropy inspired by the Brooklyn Ladies led to the formation of MJHS Foundation. Today, the foundation remains committed to raising the funds necessary to provide compassionate care and innovative programs for the individual as a whole, whether it be supportive needs, medical needs, or spiritual needs. That commitment is a continuation of the dream they had back in 1907. The lesson of the Brooklyn Ladies is simple: caring is doing.